Hi, I'm Dr. Melissa Singer, and I'm a pediatric hematologist-oncologist. I'd like to thank Dr. Roger Duncan for inviting me to be a part of the T. Leroy Jefferson Career Society Medical Symposium. I'd like to tell you a little bit about what I do and how exciting it is and how rewarding it is. So, being a pediatric hematologist-oncologist, that means I treat children and young adults from newborns to school-age children to teenagers and young adults even into their young 20s with blood diseases and cancer. What I like about this profession is that I see a very big range of patients. I see hematology patients maybe for several visits for either blood problems or bleeding disorders. And then of course I see the patients with cancer, which involves giving the patient and their family this devastating diagnosis and really taking them through the journey of their treatment and then following them afterwards. And the beauty of that is that we have about 85 to 90% cure rates for children and young adults with cancer. So it's very rewarding. I see patients in my office and I also see patients in the hospital. And I can be also asked to see patients in the neonatal intensive care unit or in the pediatric intensive care unit or on the pediatric floor for consultation. So it gives a lot of variety in terms of where I treat patients. I also get to do lumbar punctures because many patients with leukemia and lymphoma need actually chemotherapy in the spinal fluid. And I do bone marrow aspirates and biopsies. So therefore I get to do those procedures on my own. And again, it's incredibly rewarding. I knew from a very young age that I wanted to become a doctor. I knew I really liked taking care of children, so that was really my focus. I went to college at Cornell University in upstate New York, and I remember in order to be pre-med, we only had to do 4 sciences. We had to take biology, chemistry, organic chemistry, and physics, and we also had to take calculus. So I know sometimes if you're thinking about going to medical school and even college, you think of the expense of it, which definitely it's expensive. But there are definitely scholarships out there and financial assistance. In medical school, we actually had several of the students do ROTC, which they got involved in. That actually paid for them to go to medical school. It paid for their books. And they had to give back time and spend time in the summers. But there are definitely going to be options if it's something you want to do. So make sure you talk to your career counselors, your guidance counselors, and again, ask a lot of questions because you don't want that to be the deterrent. So in my freshman year, my biology class, there were many kids, college students like myself, who wanted to go into medicine. But if they didn't do well on a test or two, they basically dropped out. So what I want to say to you is that whatever your dream is, don't let a difficult class or not doing well on a test dissuade you. You need to keep pushing forward because there are going to be bumps along the road. Not everyone's path is perfect, but if you really want to become a doctor or do something in medicine, you need to push through and ask for the help that you need. After that, I went to medical school at University of Miami in Miami, Florida, which is the second biggest medical center in the country. So it was super exciting, tons of patients, lots of experience and exposure. I then went to Georgetown University for my internship in pediatrics, which was also a great experience, but at a lot smaller hospital. So I actually wanted to come back to University of Miami because for me, when you're training, you want to get as much exposure as possible. You want to see as much as you can see. Because let's say you're doing a rotation in OBGYN, delivering babies. You may never get to do that again. So my plan for myself was to do as much as I could while I was training and give it 100%. And I felt at a bigger campus, bigger medical center, I got that opportunity. Then after finishing pediatric residency, one option was to become a pediatrician or do a subspecialty. So I did the subspecialty in pediatric hematology oncology. I went to Children's National Medical Center in Washington, D.C., and I spent 3 years doing the fellowship. During fellowship, I had the option of doing lab research called bench research or getting a master's. So I actually went to George Washington University and got a master's of public health during my fellowship. Right now, I'm standing in my office of Palm Beach Pediatric Hematology Oncology. This is my own practice, which I started in 2006. I was a part of several other hospitals before that, but got the opportunity to start my own practice. And the only thing I could say about that is it's, again, incredibly rewarding, but they don't really teach a lot of business in medical school. So again, it took a lot of asking questions for other doctors that were in private practice. So that's probably a place where medical training can improve, really teaching doctors how to either run a business and deal with insurance companies and everything I had to do. But we're almost about 15 years, and it's growing and thriving, and I have a great staff, and we really give great care to my patients. So the one thing, couple of take-homes, is you can reach for anything you want to be. Ask as many questions, get as much exposure and experience as possible from other professions. Diversify what you do to make sure it's really what you want to do, because you have to be happy with whatever profession you choose. Of course, it is work, but you want to at least enjoy what you're doing. Don't let any bumps in the road stop you. Everyone has bumps in the road. I had bumps in the road, but it's about keep striving, keep pursuing. I am available to any of you if you ever have any questions. You can call my office at 561-798-9119. Ask for Dr. Singer. I'll certainly get back to you. We can set a time to talk, and I could be a mentor to you or assist you in any way and answer any of your questions. So being a part of the medical profession is incredible. Everyone needs health care. There's a lot of variety of what you can do. There's places all over the country where you can work. So going into medicine is an incredibly rewarding experience, and I wish you all the best of luck, and thank you so much again.